Hello, my name is Randall Crutcher, and today I'll be discussing cases 2 and 4. All right. So, in case 2, we got a 16-year-old female that was recently diagnosed with a deficiency of muscle glycogen phosphorylase, and she and her family just have some questions that they want to kind of go over. And so we're going to be going through that with them, kind of. Their first question is, so they're not sure what the issue is, and they want further explanation of how muscle glycogen is normally used during exercise. So I'm going to look here at these two images, which are comparing the normal muscle contraction with a diseased muscle contraction. So muscle glycogen functions as a source of glucose for muscle cells during exercise. Muscle glycogen is converted to glucose 6-phosphatase, and the G6P is a skeletal muscle energy source. Glycogen is then broken down to produce glucose. So this is the glycogen molecule right here, and the glucose here. And the glucose molecules are then oxidized to produce ATP here. And the ATP molecules, which drive many cellular processes and is required for muscle contractions. So you'll see that, and this is the normal kind of circle with that. Here, we have the glycogen, but it is not metabolized, so there's no glucose available, and so there's a ATP shortage. Let me move myself up here. And so the muscles, they can't contract because they lack that ATP. So it leads to muscle failure, injury, and whatnot. So their second question is, does she really likes to take walks? Will she still be able to do that with her friends? So yes, she will. So McArdle's disease is a rare muscle disorder. In this disease, the muscle cells can't break down complex sugar, the glycogen. So this disease could make it challenging for her to exercise without becoming tired. So in intense exercises and isometric exercises, you'll see muscle pain, cramping, and damage. Though you may find that this doesn't happen with gentle walking. You may experience trouble with strenuous exercises lasting more than a few minutes. And you might also notice that after a brief rest, you feel the energy to exercise again. Say after 8 to 10 minutes of exercise, and what this is called is a second wind phenomenon. So after some exercise, take a 8 to 10 minute break or so, and you may have the energy to get back at it again. So if she was walking, she got tired, sit down, take a little bit of a break, and she'll be able to continue on. So she just needs to be mindful, pay attention to her body, those muscle cramps and whatnot. So, and if she just notices any brown, deep yellow, dark brown urine, so she'll want to come in and get that checked out. So her next question is, as a result of this deficiency, will I need to get up at night to maintain my blood glucose levels? And the answer to that is no. She will not need to do that. There's no need to wake up in the middle of the night to avoid hypoglycemia. You can use diet and exercise to kind of control this, and it's critical. You want to have a plan that you and your provider have come up with in order to manage your health care there, your eating habits. Last question that they have is, does she need to worry about producing excessive lactate during intense anaerobic exercises? Like lactate is what when you have sore muscles, that's what that's from, some lactate buildup. And the answer is no. So what we're looking at here, this is a control group here of lactate. after exercise, and this is patients with McArdle's disease, and you'll see that there is basically, that's a flat line right there. There is no increase in lactate at all in their blood. So so no, that's not something she needs to be concerned with. Anyways, so moving on to case number 4. So case number 4, we're dealing with a 2-month-old female that presents with jittery spells several hours after breastfeeding. Her mother reports that she's not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping more than 2 hours between feedings, and that's when the mother reported these symptoms starting. Laboratory results are consistent with hypoglycemia, but are otherwise unremarkable. Epinephrine was administered, and there was no increase in blood glucose, but there was an increase in blood lactate. A physical exam showed liver edge 4 centimeters below the right costal margin, percussion in the right chest, abdomen confirms an enlarged liver. Blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within the normal range during fasting. So based upon the presentation, which of the following is most likely the diagnosis for this patient? So let's take a page here. So the first 2 considerations are glycogen storage disease, enlarged liver. Patient presents low blood glucose level. She also presents high lactate level, presents impaired growth. We're not seeing any impaired growth. Keep in mind, she's only 2 months old, so probably won't see much of that. Acidosis, hyperlipidemia, swollen belly, bruising. Those last several are something that we would probably expect to see in a patient with this that was maybe a little bit older, but because of her age and what she is presenting, I feel comfortable, that this is what she has. But we need to look at 3 others just to rule those out. So hereditary fructose intolerance. Symptoms are nausea, bloating, abdominal pain, diarrhea, vomiting, and low blood sugar. She's only presenting low blood sugar, so we can, rule that one out. Also, galactosemia, convulsions, irritability, lethargy, poor feeding, baby refuses to eat milk, poor weight gain, jaundice, vomiting. She is not presenting any of those, so we can rule that out. And glucose 6-phosphate dehydrogenase deficiency, rapid heartbeat, shortness of breath, urine that is dark, yellow, orange, fever, fatigue, dizziness, paleness, jaundice. Again, no symptoms, rule that out. So, her diagnosis is GSD. She does not have, what that means is she doesn't have the enzyme needed to turn glycogen into glucose in the liver. So glycogen builds up there. So symptoms include like a swollen belly because of the enlarged liver. These symptoms often appear in babies around 2 to 4 months old. 3 to 4 months old. She's at 2 months, so she's kind of on the front end of it, so that she's presenting several symptoms, but not all yet. So if she was a couple more months older, we might be seeing more of this, but looks like we're catching it early. And the reason for the increased blood lactate after injecting epinephrine is due to the lack of the enzyme which breaks glycogen, breaks down the glycogen from glucose. So anyways, that is all from me today. Thank you very much.